Hello, everyone. So this year, the AI Health Summit is about trust in AI. So at the beginning, we'll just have a moment because I really love to do something. We'll have an experience together, okay? You will follow? Yeah. Can you just pick up your phone? Go ahead, we are going to do a little clinical trial together. So pick up your phone and open the last message, the last email, the last Slack you sent or you received. You done? Okay, and now if I tell you to pass your phone to the person on the right. Not easy. Maybe secret message. Maybe someone you spend the night together, I don't know, but yeah, this is really about trust. You know, you don't know the person on the side, and I'm asking you to share some data. And it's not a biology result, it's not a medical imaging, it's not an MRI, it's not something really sensitive. And basically, that's your, as a company, AI company or hospital, you want the patient to do. Share sensitive data with someone who the patient doesn't know. This is something important. So to build a specific and trusted AI, you need to really begin at the data collection and the information and just build this trust at the beginning. So that's our job at Dr. Data. We create this bridge. I like to talk about bridge because we are used to hear that the patient is in the center of the healthcare system, but not for data. But we have all digital life. And with Gen AI, etc., we will have also a lot of digital health in our health field. And this bridge between patient and stakeholder is basically about communication. Because as DPO, this is our first job, data protection officer, we are used to hear from patient that the health data is mine. So there is this debate about ownership. And then only my healthcare professional, you know, my GP can access to my data, which is like an nonsense. It's not like that in a hospital and when you work with a lot of providers. And on the other side, you have healthcare professionals in this industry thinking that, you know, I'm doing this data processing for their own good. The patient will not understand if I'm trying to explain. So no, you're doing the right marketing for the product, so do the right marketing with the patients. Talk to the patient like a normal person. Don't use big words, technical words, or legal words. So this is really the first step about information. And we had a lot of problems in a lot of research projects in hospital and with companies because you need to reuse data. So doing this secondary use of data, of a large volume of data, a large volume of patient, and you need to inform this patient. This is really a big thing. So that's what we do, and we are a lot of crazy a little bit. We use smart contract. We are Dr. Data, okay, it's a good name. We are a DPO, so we are not at the beginning software provider, but we wanted to add this technology layer to add, again, transparency and trust. And we built this solution powered by blockchain named Isolid. And we are using this technology to manage patient rights. So information with opt-out and information with opt-in, which is consent, which is really important in secondary use of data. These are the main use cases we have in our research. So I gave you an example about data studies or sharing health data with someone you don't know. But in clinical trial, most of the time, you need to decentralize the e-consent because you don't have both parents in the same office with the doctor to collect the consent and give this information. So let's imagine that. You can live far, far away from an investigator site and you don't have the chance to go make the journey to collect the consent and getting the information and had the chance to participate to the clinical trial. It is something really important because it's really about also inequalities between people to have access to health and research and medical science. And we have a lot of fucking on patient needs because the patients need transparency, as I said, a lot of information, and the patient of today needs to understand everything. Otherwise, he will go to ChatGPT or Google to find that information. So this is really about creating this link and use the right word with patients and just not be afraid to say that you're using the data, because we're using all your data today on website with the cookies. Okay, but you can share your IP address with the person you don't know. Can you share the sensitive data with the person you don't know, since you're not sharing everything with a lover? You know, it's something really, really important to have in mind. And yeah, when we talk to hospitals or companies, for sure, we are something really interesting for them, because they gain in efficiency, there is less burden administrative also on them. And we are really here to boost project. For us, there is no compromise to do between innovation and privacy. Okay, we're sending people to the space. We can inform a lot of patients about the data. This is really important to do that and to think like that. And for clinical trial, for instance, for a sponsor, a pharma sponsor, or biotech sponsor, it's really important also to know when he will have access to the data and that the data is compliant. This is really something we also need to learn in Europe, because you know in the US you have a lot of litigations. It's easier to explain the smart contract technology and how we will create a lot of integrity in the data. But in Europe, it's a begin, because, as you understand, you have the AI Act. So you need to inform the patient at the beginning, but you will need also to inform the patient when you will use the AI in the treatment, and the patient has the right to opt out. This is really something important, because it's not about ownership, it's not about control, it's about freedom. For all of us. And for sure, less breaches, which is something really appreciated by authorities, by the way. So it's really important also for your business. This is the main promises, and we took these promises to reality, because we have more than 30 end-user organizations using the solutions since last year. So biotech company, pharma company, hospitals, private and public hospitals. We have more, this is the number from last week, and now we have a lot of more patients involved, giving their consent or opt-out or opt-in. And from our experience, a lot of patients are just asking for more information. There is not a lot of opt-out, you know. They are looking how the research is going. What is the result? How can I contribute more? You know, it's really something you can appreciate when you're on your bed and you're participating in the medical research by doing nothing. This is something really important. And for sure, we create something, a technology that you can scale a little bit more on the large volume of data you can process and the large volume of patients you can inform. So if you want to inform, I don't know, 1,000 patients, it's the same time that 1 million patients. Just need to upload the number of data and you will do everything. So this is really important also to think about it. We have to patent, which is important here. I want to say it's you, each citizen, each patient. You have your own consent store. So if someone like, I don't know, Johnson & Johnson is asking for your data and you need to opt in or opt out, or APHP here asking to your data, you need to opt in or opt out, or a clinical trial, you have the same place to say yes or no, to find the information, the education. This is really something important because it's centralized functionally, but decentralized technically. This is important about data integrity you want to build. So we have some partners here in the room, so we are really happy to work with them because it's really about building a new society vision. You cannot use the IP address, as I said, that is sensitive data. This is something important you need to know. And we are booth 33. If you want to see us, we are launching something really big at the beginning of the year for the company using telemedicine AI in the software. So you can just plug and play our API, and we will act as a trusted third party. So this is something really important to come, and you will have this to release the first smart contract consent API. Thank you.